Hi everybody. So I'm going to give you some tips for cardiac and for EKG. One of the things that I see really often in my office is students who are having a hard time with cardiac anatomy. So you've got to get your cardiac anatomy down. Luckily, there's so many awesome resources for cardiac anatomy on YouTube. There's no shortage of you finding anything that you need to find on there. So if you're having a hard time not knowing where your chambers are, like your upper chambers are your atria, so your right and left, they squeeze first. Then your ventricles down at the bottom, your right and left, they squeeze second. And then you have your pulmonary artery and your aorta and your semilunar valves in there. Understanding where the blood is coming from, where the blood is going to, and how the heart physically functions is going to be very, very important for cardiac. So if you're having a hard time with that, take some time, go to YouTube, go to your textbook if you like to read things, go to YouTube if you like to see things or hear things, and look that up. So, cardiac anatomy. You've got to figure that out first. The second thing is understanding your terminology. You're going to hear a lot of different terms. Terms like depolarization, repolarization, systole, diastole, contraction, relaxation, ejection fraction, stroke volume, cardiac output, all of those things. You're going to either read them in your textbook, you're going to read them in your PowerPoint slides, you're going to hear your instructor talking about them, you're going to be on the floor, you're going to hear nurses and doctors talking about them. If you don't understand what those are, how are you supposed to help your patient? How are you supposed to understand anything when it comes to that information? So take some time if you're by yourself and see those things to look them up. If you are in your textbook and you don't understand what it means, go to YouTube. I'm a big YouTube proponent. Make sure that you look something up and then clarify it with your textbook. But in general, you just type in nursing school, cardiac anatomy, and you're going to find a ton of different resources in there. Third, super important thing is to understand the basics of EKGs, knowing what a P, a QRS, and a T actually means. So cardiac basics. Understanding the basics. So if you're not understanding that, your textbook, I know I keep saying your textbook, I really do like your textbook for this class. This textbook has awesome resources in it. So your very first chapter of the unit for cardiac is the assessment chapter. Go in that chapter and look up the EKG information. It is very, very helpful because it tells you exactly what everything is. And then in the next chapter, where it starts talking about all the issues that the heart can have, it shows you this awesome chart of each individual EKG pattern. Then on the right side of it, it says what the characteristics of that EKG is. And then to the right of that tells you the nursing considerations of all the things that you need to know and do for your patient should those cardiac arrhythmias present themselves. So take some time, understand anatomy, understand your terms, and understand your basics of what a P, a QRS, and a T means. Because your heart beats with your atria first. Ooh, did you see my pen? It just rolled all the way over there. Your atria and then your ventricles. So your heart should be beating like this. Hopefully, it's beating like this. So every time this squeezes, every time your atria squeezes, you're going to see a P wave. So P. Every time your ventricle squeezes, you should see a QRS. So P, QRS, T is when your ventricle relaxes. So P, QRS, T. P, QRS, T. So as you're looking at your EKGs, I look to make sure I have QRSs because that's my ventricle contracting. And if I don't have my ventricle contracting, my patient's in a really bad spot. They're dying. No ventricular contraction means no cardiac output, which means dying patient. So I always look for those first. That's my personal way to start because the EKG the QRSs are the biggest thing on my EKG. So I look to make sure I have QRSs, and then I look to see, does every single QRS that I have on my 6-second strip, does it have a P wave before every QRS? Because it should, because your atrium squeezes before your ventricle does, because it squeezes all the blood out of the atrium. Now all of the blood's in my ventricle, then all the blood squeezes out of my ventricle out. So I look to see, do I have QRSs? Is there a P wave before every single QRS? And then I like to see, are my QRSs spaced out the way they should be? Are they equally spaced from one another? So I'll just draw a quick picture. I should have a P, a QRS, and a T. A P, a QRS, and a T. P, a QRS, and a T. Right? So this is my R, QRS, QRS, QRS. So the R to R interval, these spaces should be equally distanced from each other. It's like the one time in nursing you're allowed to say regular. This is a regular rhythm because the spacing of my R's are equally distanced from each other. If they were irregular, if one was here and the other one was spaced out more and then spaced out more or even smaller, that would make it irregular. So understanding anatomy, understanding your terms, and understanding the basics of an EKG. Then branch out and try to remember all the different ones. But as you're looking at those arrhythmias, literally think about what that arrhythmia is representing. Is there QRSs happening? If all you see is QRSs, and your rate when you count how fast it is, it's like 140. If all you see is QRS, 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 what does a QRS represent? A ventricle contracting, right? So all I have is ventricles contracting. And if my rate is faster than 100, what does that mean? Is it bradycardia, sinus rhythm, or tachycardia? Right, greater than 100 is tachycardia. And if it's all my ventricle, it's my ventricle having tachycardia. So what do you think that rhythm would be called then? I'm probably not even going to say it. You guys can figure it out. So when you're looking at arrhythmias, if you know the basics, you're going to go a lot farther and you're going to have a lot more sanity when it comes to looking at EKGs. So thank you, and I hope this helps. Bye.